The next presentation by Pragati Raj on efficacy and safety outcomes of intravitreal brolucizumab injections, ENSURE study.
Good morning, everyone. I'm here to present the study, ENSURE study. There is no financial interest or conflict of interest. So there are numerous retinal and choroidal pathologies like DME and neovascular ARMD that is predominantly driven by VEGF, and has anti-VEGFs have been a standard of treatment. The most recently approved is the anti-VEGF brolucizumab and faricimab. Discussing the brolucizumab, it is a humanized single-chain antibody fragment that inhibits all isoforms of VEGF-A, and since it is only the variable part of the antibody, so it has the least molecular weight amongst all, and that enables us to give a high molar dose with high drug concentration, and it increases the duration of action. And it also has 11 times more VEGF binding capacity than aflibercept and 22 times more than ranibizumab. It was introduced in the global market as Beovu in October 2019, and in India as Pegenex in October 2020. The landmark trials being Hawk and Harrier and the Kestrel and Kite that was done for neovascular ARMD and DME respectively, and it was seen to be non-inferior to 2 mg aflibercept, and also the rate of side effects that was seen was approximately 2 to 4%. So the safety concerns have been raised due to incidence of intraocular inflammation in eyes receiving brolucizumab, and many centers had either stopped the usage or reserved it for resistant cases. So a retrospective study was done at a retina clinic of Tertiary Eye Care Center in Bangalore from October 2020 to January 24, and only cases injected with brolucizumab injection was taken into consideration. The methods include the data collection of demographic details, the laterality of the eye, visual acuity pre and post injection, indication of injection, disease diagnosis that included both on and off-label diseases like macular edema caused by vascular occlusion and DR and post-PPV, and choroidal diseases like CNVM caused due to ARMD or myopia, choroidal osteoma, and pachychoroid-related diseases. Also, the treatment history was seen, that whether the patient was treatment naive or treatment switch, and follow-up details that was seen with the visual acuity ETDRS letter and the OCT that included the central subfield retinal thickness and the fluid and hemorrhage conditions. And also the safety information was taken between 4 to 8 weeks after the injections, including the anterior and posterior segment inflammation. So the inclusion criteria included the treatment naive and the treatment switch case with the details we had from 4 weeks to 8 weeks after the injection, and all other cases were excluded. So for results, there are 926 injections were given within the period, and that included 237 males and 153 females, with retinal pathology being 183 and choroidal pathology being 267, and the treatment naive cases being 135 and switch being 315, and average number of injections was 2.4. The most common diagnosis for which injection was given was neovascular ARMD, with 48% and 24% being DME, and all other diagnoses. So it was seen that the statistically significant decrease in CSFT was observed, and resolution of PED, SRF, and IRF was seen in cases when retinal and choroidal pathologies were amalgamated together. In cases of choroidal pathologies, the vision deteriorated, but the CSFT improved, and PED, SRF, and IRF resolution was seen, and 18% cases had to be switched to other modalities of treatment. In retinal pathologies, vision also improved, as well as the CSFT reduced significantly, and PED was not found to be, resolution was not found to be significant, but SRF and IRF was found to be significant. So as a comparison, a statistically significant improvement in visual acuity and a significant reduction in CSFT following injection of retinal pathologies was seen. And on the safety outcomes, 3 cases of intraocular inflammation was seen, with 2 being anterior segment and 1 being posterior segment, and that needed the PPV, but the vision was restored. So the incidence was 0.3% per injection, 0.7 per eye, and 0.8% per patient. So a real-world brolucizumab study demonstrated improved anatomical outcomes for both retinal and choroidal vascular pathologies, but demonstrated visual improvement only in the eyes treated with retinal pathologies. Lower incidence of IOI and RV was seen compared to the clinical trials. So we conclude that intravitreal brolucizumab should be continued for different retinal and choroidal pathologies with proper monitoring of patient symptoms. Thank you. Yes. So
okay. From 30%, the incidence you say is less than 1% here.
Yeah.
So 30-fold decrease. First thing, I don't think anywhere it is reported about 30%.
30%,
No.
1.7 in VRSI, the study in VRSI is 0.7 to 1.7.
No, somewhere you have written that it is 30% in various studies and some studies, first or second slide. I don't think 30% is ever reported. The latest study, Merlin study also says it is 11%, which is also too big, too high an incidence. In your case, in your series, the incidence is too low. So what you think is the probable cause?
Sir, in our case, the most common regimen that we followed was PRN regimen. So that could also be a cause because we were just assessing the patient, and according to the disease activity, we were injecting the patient. So that could also be a cause for decreased number of injections that we gave. The average number of injections were comparatively lesser than the other studies.
Is there any data on this? The maximum number of injections given?
Ma'am, in Hawk and Harrier,
In your study?
yes ma'am, it was 2.4.
2.4.
Yes, ma'am. A range of 1 to 18.